Welcome. Happy March. As promised, it's come in like a lion. Hopefully, the weather starts to get a little nicer as we move to the back end of the month and anticipate spring. But today, I want to talk to you about sort of the state of the state. Where are we in Wilmington? What are the key things that we're working on? What are some of the priorities that we have, and why they're priorities? So my job is to get through this in about 7 minutes. There's 32 slides, so I'm going to give you the Reader's Digest version. So really what we focused on today in the town hall is sort of where we are as an organization. Right now we're caring for about 31,000 lives throughout all of Delaware and South Jersey. That's about a 45% market penetration rate. So there's great opportunity for us to improve the number of veterans that come to VA to choose to get their care in VA. But the only way that they're going to come and get their care with us is that they would have confidence that we're providing high quality care that demonstrates to them that we value them on a daily basis. That's why we've set as our goals, one, we need to be veteran focused, that every day in everything we do, in every service, that we put our veterans first. Two, that we make this a better place to work. If this is a good place to work, we're going to provide better care. We provide better care, more veterans will come. And then lastly, we need to make sure that we develop a culture of fairness, quality, and excellence with good communications about who we are, what we're doing, why we're doing it, and why veterans should get their care with us. So to that end, we spent some time today kind of reviewing where are there opportunities to grow. We're one of the only medical centers in Vision 4 that really has a chance to grow, particularly in lower Delaware in South Jersey. To that end, that's why we're pushing to add additional outreach activities and staff to get the word out to veterans, to do some service recovery where veterans hadn't chose us because they had a bad experience. How do we get them to come back and choose us, and then make sure that we're providing high quality care? We have been growing. We've shown substantial growth over the past 3 to 5 years. Last year, pretty much in all of our clinics here at Wilmington, as well as in our 5 community-based outpatient clinics, we've shown growth. That means more uniques, it means more encounters, it means more service. We need to continue to do that. That's why we have plans to expand a new clinic in Cape May. That solicitation's out on the street right now. We have plans in Washington to expand Dover, and we're eager to hear that that's been approved later this month. So that we can start working on expanding that clinic. That's key. Kim reviewed the budget. Roughly, we have a budget, an operating budget of about $191 million. So what that means is that we have to be smart about what are the resources we bring on. How do we use those dollars, particularly since the dollars come in buckets. There's different colors of money in VA. There's medical, there's facility, there's the admin. We need to make sure the medical is really focused on putting the veteran first, and that the admin gives us the supports we need to deliver high quality, timely care. There's challenges there, but as we prioritize our foundational services, we should be fine going forward, but it's clear we have to be smarter about who we bring on, and anybody that we add to our team really needs to add value to the organization and to the quality of care that we're delivering to our veterans. So that will remain a very big focus as we go forward. We then spent some time reviewing the data. Where are we when you look at the quality VA data? The latest data that's out there right now is the end of last fiscal year, where when you look at 146 VA hospitals, we've progressed. We're now rated 91. We're at the top of the 4th tier, which shows tremendous progress. In the prior year, and prior quarters, we were rated around 118, 117. So within the last quarter, we've made tremendous progress. Our hope is that as we continue to focus on some key elements related to care coordination, veteran satisfaction, timely response to veterans' concerns, looking at our ambulatory sensitive care conditions, and mental health issues, that we'll be able to drive positive change and to even further improve our quality rating. We've gotten some good news lately where the ratings that came back for our community living center were substantially better. We're now considered a 4-star there, but we're not satisfied with that. The CLC team has taken on some new activities and a new focus, looking to add some additional restorative care services and improve the daily programming for our veterans that call the CLC home. And so that team is actively working on making sure that not only we provide high quality care, but that we deliver that in a compassionate way. So I'm excited about the efforts that they've undertaken. They have a new staffing model, new leadership, and I expect great things to continue to move forward with the CLC team. The other thing we reviewed is we spent some time looking at the feedback veterans give us. And I spent a lot of time in the meeting today asking folks to really think about this and focus on it. What the veterans are telling us is that at times they don't always trust that we're true to the VA mission, that we don't always meet their needs when they come in, and that they have concerns that our care isn't coordinated. And that is whether it's our primary care providers referring to specialty care, or it's us working with choice in the community. They feel that that care is fractured. So we need to be working extra hard to kind of demonstrate to them on a daily basis that we do care about them, that they can trust us, that we are listening, and that our number one goal is to really put them first and make sure that their needs are getting met, not only by the quality of the care that we deliver it, but in the quality and the way in which we deliver that care. So that's a major focus. We have data that's up on our homepage. There's a tile that allows you to look at how your particular service is doing. It breaks it down by inpatient, outpatient, and by the different CBOCs. And I'm asking all of us, and particularly our leaders, to really kind of make sure they put that front and center, that our veterans need to feel valued. To that end, there's a national movement in VA to look at strategies that promote uniformity in demonstrating that we care about our veterans. The Veteran Experience Office has 5 different initiatives out there. I encourage all of you to look at the PowerPoints that were included in today's town hall to give you a little bit more details on that. But what it really boils down to is making sure that we're not only doing technically the right thing, but that we don't forget our bedside manner, and that in everything that we do, we demonstrate to the veterans that we value them, and that we demonstrate to each other that it's important that we be a team and that we value each other's contributions to the care that we're delivering to our veterans. That's been the main focus. The good news is the data is moving in a positive direction, that the efforts that we're doing as we move to more of a team-based management approach, it's having a very positive impact. We are making progress, but we need to continue to get smarter in how we deliver the services and how that we work so that we can get the efficiencies and the outcomes that we're looking for. They're really the key highlights. There's the opportunity to look over the PowerPoints. There's also a couple links that will give you the opportunity to dive into the data a little bit more. I hope this is helpful. With spring, there's opportunities for hope. There's signs of real progress, but we need to work together to really continue to make sure that we're getting veterans engaged, that we're keeping them engaged, and that we provide high quality, timely care to our veterans and their support systems. Thanks for all you're doing. Talk to you again next month.